back to Good Morning Arkansas. You know, we all want to live long, healthy lives, but sometimes we have some medical interferences, and one of them can be hypertension. Dr. Bushra Shah from the Longevity Center at St. Vincent is here to help us navigate through some of those issues. Thank you so much for being here today.
My pleasure.
And hypertension really is a challenge for a lot of people, isn't it?
Absolutely. There are about 50 million people in the United States who are suffering from hypertension, 1 billion in the world.
Wow.
And about 30 million visits to the primary care doctor every year with the issue of high blood pressure and uncontrolled hypertension.
Well, we definitely want to work on controlling that, and hopefully we'll get to visit with you about some other specifics. But let's go ahead and take some of our callers right now. We have on the phone Patsy from Bald Knob. Good morning, Patsy.
Good morning.
You have a question for the doctor?
Yes, I have hypertension, but I'm on medication, but sometimes it goes up and sometimes it goes down. So what do I do then?
Okay.
Good morning, Patsy. And that's a problem that a lot of patients do suffer from. It would be, what I would advise is that you keep a log of your blood pressures. Your blood pressure that is ideal is 140/80 or less. When it goes above the top number, which is systolic blood pressure, goes above 140, and the bottom number goes above 80, then we do not have good control. And our goal should be to keep you under those numbers. If you have diabetes or kidney disease, then our goal is to keep your top number 130 or less and your bottom number 80 or less. I don't know how many medications you're on, but sometimes one medication is not enough, and you have to be controlled with 2 medications. Typically, we start with a class of drug called thiazide diuretics, and your doctor can add other medications. You know, and maybe you need to time it where you're taking your medication at nighttime if you're standing for long hours, and you get what we call orthostatic hypotension, where it drops down, depending on what your diet is like, what your activity is like. So I would recommend you keep a log of your blood pressure and then take it to your doctor and review with them, and they have to motivate you. They have to talk to you about lifestyle, diet, and then work with you in adjusting your medications. We do encounter, it's not a magic wand or a quick fix at times. You have to go through an adjustment phase, and then we hopefully achieve the goal that we want.
Okay, thank you very much. And we have another caller now from JONESBORO. Good morning, Betty.
Good morning. I have a question. My husband has an aortic aneurysm, and we really try to keep his blood pressure down, but and usually it runs good, but we have noticed that sometimes the lower number is in the 40s. And what could we do to bring that back up real quick?
Okay, thanks, Betty. We'll let Dr. Shah try to answer that for you.
Good morning, Betty. If it's just his bottom number that drops down and the top number stays within normal range, or then maybe you need to cut back on his blood pressure medication, and that's something you need to talk to your doctor about. And again, as I advised the caller that was before you, that it's very important that you keep a log of your blood pressures. You take them to your doctor. You discuss at what times it goes up or down, and then maybe he's on too much medication. Maybe a different medication can suit him. There are different classes of medications for blood pressure, and one drug may not be the one that's best for you. Typically, we start with one therapy. Sometimes patients need 2. Most patients need 2 drugs to control their blood pressure, but there's certain medications that we cannot give certain patients for because they have concurrent medical problems. So I don't know which medicine he's on, but that will be something that you would need to discuss with your doctor. And you said, what can you do to quickly get it back up? That is, if he's feeling dizzy, lightheaded, or having any symptoms, you need to stop taking the medication he's taking and call his doctor.
Call the doctor right away.
Yes, and try to make sure he's not dehydrated, or he's drinking enough fluids, things like that.
Just make sure there aren't some other issues that could be addressed. Well, thank you so much for this timely information, and unfortunately, we could probably talk about it all morning, and we don't have the time to do that. But if you do have additional questions, you can always reach the Longevity Center, and I'm sure Dr. Shah would be happy to get some answers for you, or her staff there at 1 St. Vincent Circle. You see the phone number on your screen, 552-4777. Thank you once again for your time this morning.
My pleasure. Always.
All right, when we come back, we're going